Good morning, everyone. Today I want to have a chat with you about patients accessing their superannuation to pay for their dental treatment. So first, for credibility, my name is Khaled. I have been a dentist for 20 years. I own and run my own dental practice, Lakeside Dental Spa in Hervey Bay, in Queensland. I took it from 1 chair to 10 chairs, from 3 staff members to 40 staff members over the course of 14 years. And you can check my details below for credibility. So I've been reading on some dental forums, some dentists saying that if you have, let's put an example, you have a young patient, let's say a 40-year-old patient. This patient needs a lot of complex dentistry, could involve many crowns, they have worn down teeth, involve taking the teeth out, putting implants, for example, and they don't have the finance to pay for that treatment, but they have, let's say, I'll give a random example, $40,000 in their superannuation, and their treatment is going to cost this much, and they want to access their superannuation to pay for their dental treatment. Some dentists are very strongly opinionated about this topic, and they think it's completely unethical for a dentist to offer that to the patient. And because their point of view, if the patient accesses their superannuation and they have this treatment in their 40s, and then it fails in 10 years or in another 15 years, they require this treatment again, they might not have money to pay for it, and they don't have their superannuation, and they needed their superannuation for retirement anyway, and they miss out on that. My point of view is a little bit different than that. For me, I would say it as follows. Let's say this patient is in their 40s, they had a good career, they looked after their teeth, but they went through a downhill in the last 3 or 4 years. They had some bad events happen in their lives. They had to go through drugs or depression or certain medications that affected their teeth, and now they lost their job and they want to go back again and restart their life again. If you deny them and deprive them from complex dentistry or ideal optimal dentistry just because you think it's ethical for them to access super, and that is the only way they can pay for their dental treatment, imagine the amount of missing opportunities they will miss out on if you haven't fixed their teeth properly. But the way I see that is they are properly informed about the drawbacks of accessing the superannuation, and they understand the taxation problems with that. They understand the long-term problems with dentistry, and they still approve it, and they access optimal dentistry, and you manage to give them beautiful results. And this beautiful result will turn their life around, and they start to have a job or a better job, or start their own business and start to become successful, and they get their life back on track. Maybe in the next 20 years, they will make a lot more money. They will put more money into their super, and their whole life will improve, and everything they pay from the super will be a good investment for them. On the other hand, if you think it's unethical and deprives them from that, and their life hasn't improved because of their teeth, and yes, they kept their money in super, but in the next 10 or 20 years, their career declines, and their opportunity declines to develop themselves, and they end up much worse. Later on, when they retire, maybe I haven't done them a service. So as a dentist, I will discuss with them all the possible options. What is the ideal, what's the compromise? If their only option is to access superannuation, they understand that, and I feel like I can improve their life, I don't think it's unethical, and I have no problems with it. If you find this information helpful, make sure you like and share with your friends and colleagues. If you want to hear more about my videos, please subscribe to my channel, and you'll be notified when I release more videos. Thank you so much for listening to me. It means a lot to me.